My name is Anastasia Bosire. I am the Patient Navigation Program Manager at the Cancer Treatment Center, Kenyatta National Hospital. Cancer is the second leading non-communicable disease in Kenya, and it affects people in all walks of life. But those in the lower and middle income group, as well as the young, are a vulnerable group that the impact of cancer affects the most. And Kenyatta National Hospital, being the leading referral hospital in Kenya, it is also a leading referral hospital in the East African region, receives many patients who come seeking treatment. Because this treatment is available in Kenyatta National Hospital, all the modes of treatment that are necessary, at least the basic that are necessary for the treatment of cancer, are available at Kenyatta National Hospital. Most of the patients that we receive in Kenyatta National Hospital fall under this lower or middle and lower income category. So the impact of cancer is felt in this group more. So when they come to us for treatment at the Cancer Treatment Center, then we see some of them are really struggling to go through the treatment that they have been put on, because especially because the treatment is expensive, and some of the investigations that they require to be done for them to go through treatment are expensive. Also coupled with the fact that cancer is not very much accepted within the community, so they'll be experiencing a bit of difficulty, especially with stigma, and their support also goes down. So as we go through the treatment, or as we assist them go through the treatment, then we realize that other than the treatment and the treatment cost, they also are also faced with other challenges other than that make them unable to either afford the treatment, go through the treatment, and even complete the treatment. So based on this, the Kenyatta National Hospital and the American Cancer Society adopted a concept of assisting patients navigate through barriers that may have contributed to their being unable to complete their treatment. And this concept was adopted in Kenyatta Hospital and started ground in 2015 with needs assessment that was carried out. And the needs assessment identified a number of patients' barriers that would affect their treatment journey. Some of these barriers included financial barriers, being able to afford treatment, being able to afford the other necessities before they complete their treatment. Another barrier that was identified is information. Patients did not have information about cancer. They did not know what is required for the treatment to be started and what kind of treatment they were going to be put on and such. And we know that information is very important for a patient to be able to participate in their own care and be able to complete treatment. So information was another barrier that was identified and was very important that it should be addressed. And psychosocial problems, and especially about image, is one of the other barriers that was identified. So when the patients go through treatment, they tend to have psychological problems because of what the treatment does to them, or the effect of the treatment to them. So psychosocial problems was another barrier that was identified, together with patients not being able to navigate themselves around the hospital campus, which is big. They are not able to identify or to locate the service centers, which are scattered all around the hospital. So the patient navigation program was launched in 2017, and from 2017 patients have been able to get information about their cancer, and they have somebody to walk through with them during their cancer journey. They have information. They also receive a bit of financial assistance in those areas of getting, for example, investigations done before they can continue with their treatment. And they have participated very well in their care. And we have seen patients now walk through the treatment, being able to navigate through the barriers and even get to complete their treatment. To address the psychosocial problems, then we require to have the patient also look at themselves and accept themselves. And some of the psychosocial problems that they may have is about image. So about image, then we try to see how they can be assisted to improve their image, to accept themselves, and even continue and complete the treatment. So to do this, we have embraced partners, because we realize that we cannot be able to assist all patients on our own. Then we embrace partners who come in to join us to be able to improve the experience of patients as they go through the cancer journey. And every time that we have had partners who would like to partner with us in one way or another in assisting patients in whichever capacity they may be able, then we have embraced them. For example, when we heard that Donata Wig would like to have assist patients to improve their image by having doing a makeup for them, then we really welcomed this idea, and that is why we are here today to embrace this partnership, and we pray that this partnership continues as we continue to make a difference in the patient's cancer journey. And we know that the theme of this year of the World Cancer Day is I will and I can. So we know that we are committed to improving the experience of cancer patients, and together with Donata Wig, we concentrate and we shall continue to make the difference together.